Welcome back. The topic today is obesity and urinary tract symptoms, or even you can call it LUTS, lower urinary tract symptoms with obese people. In the previous videos, we've been talking about obesity, its treatment, and the complications or the problems obese people face. In this video, we are talking about urinary tract symptoms because of obesity. We all know we have two kidneys. From the kidney, urine comes and it's collected in the urinary bladder. The urinary bladder is situated in the lowermost abdomen part and just above the private parts. Okay. So when it fills, we have the urge to pass urine, and we pass urine. What the obese people, what are the problems they are going to face because of the weight? See, it's just the obese people, because of the overweight, the organs, the intestines and everything, they compress the urinary bladder. So you can broadly first divide into the problems because of the urinary bladder, or problems you are facing during the voiding problems, or the storage problem. We can divide that. And because of the organs are so heavy, they fall on the urinary bladder and they compress it. So the capacity of the urinary bladder comes down. So naturally somebody has a 300 to 400 capacity. The capacity will come down. So what happens? So they have to pass urine again and again. Frequency. The frequency could be daytime frequency, or the nighttime frequency will increase. That is why most of the obese people, whenever they travel, they go to some other place, they always first look for the toilet, because they have an urgency or the frequency, increased frequency urgency for the urination, because the capacity of the urinary bladder has come down. The second part is polyuria, we call it. That means they produce a lot of urine comparative to the other people. They produce a lot of, because the filtration, there is hyperfiltration of the kidney, so they produce a lot of urine, so they tend to pass a lot of urine. This is another problem. And these problems, most of the time, what happens, the alignment of the urinary system is below after the bladder, urinary bladder. You have urinary bladder, you have prostate in the male, or female, they have a ureter. So this alignment, the flow of, the alignment of the flow, because of the weight, because of the pressure, changes. These are the root cause for the main problems. So sometimes they won't even feel the bladder is full. We call that, either they feel, immediate fullness. Always they think the bladder is always full. Otherwise, the bladder will be full, but they won't feel it. So they feel the bladder is empty. So the bladder fullness problem, this can happen. And urgency, as I told you, because of the pressure and too much of urine produced, they have to run. They can't hold it, because already the weight is compressing the urine. So whenever they feel like passing urine, they have to rush to the toilet. The urgency increases. And incontinence, the next problem they can face, incontinence again, because of the pressure, the bladder is compressed. So incontinence, without their knowledge, they can leak the urine. Sometimes stress incontinence. That means, suppose they laugh, they cough, they lift something, some amount of urine can come. This again, it's all because of the alignment, problem, and the pressure on the urinary bladder. So they can get, incontinence, and stress incontinence is very common in them. And coming to the voiding problem, that is passing urine problem, they can have we call that hesitancy. That means they go to the toilet. They feel passing urine, urgency will be there, they go to the toilet, but it takes a lot of time to pass the urine, because the muscles in and around, because of all the pressure, they are weak and they will not be able to squeeze it properly, and the alignment is changed, pressure and the malalignment of the urinary tract. So they may get hesitancy and straining because of the malalignment. They have to strain a lot. If a normal people, they have to put a pressure, maybe 1 point of pressure means they have to put 2 to 3 points of pressure to pass the urine. And Disuria means painful urine. Because of these alignment, malalignment, and putting too much of pressure, they have to squeeze to get the urine out, so they can get a lot of pain during urination. Then the biggest problem is dribbling. See, most of the obese people, so they have central obesity. They're so obese, now they can't even look below the waistline. So the dribbling is a big problem. So after the passing urine, or even usually when they have normal pass, the urine instead of coming continuously, it will dribble, or there may be post-void. After passing, the urine will be dribbling a lot. So what happens? They can splash on the sideways, on the dress, in the skin, thighs, all these things. So hygiene becomes a big question. So they can't look properly, they can't reach properly to wash those areas. So because of all these things, infection can set in, especially in and around the foreskin. In the male, the foreskin, they may not be able to retract the foreskin, melanoposit, the infection, or repeated urinary tract infections. In women, they have itching, burning, or even fungal infection, or in white discharge. All these things can happen because of the dribbling, obesity related, lower urinary tract infections can cause these kind of problems. And very rarely, because of the weight and pressure, malalignment of the urinary tract, because of the pressure, there is a malalignment, so the urine cannot come. So what happens? They put a pressure. The more the pressure they give, the urine will not come. And sometimes they come to the hospital in an emergency with a urinary retention. The bladder is so huge, unless we catheterize, unless they go to the doctor or the hospital, the urine will not come. So these can happen with the acute urinary retention problem. So suppose you have all these, any of these symptoms, most of the symptoms the people may not know, the obese people may not know. How they can know is usually it will be combined with erectile dysfunction, sleep apnea, and polyuria, that means producing a lot of urine, frequency, urgency, these things, unless they have been told, they may not know. When it becomes more severe, usually they approach the doctor, and the doctor will examine them, ask the question. Sometimes they may ask for blood tests and other scans and other things, and they may even ask for the urinary flowmetry, all these things, and they can come up with the solutions, whether the problem is in the urinary bladder, or in the widening problem, or some other problem, is like diabetes, hypertension, or even thyroid problem, all these things. Then they give a solution to them. So it's always, what is the best solution for this treatment? Reduce the weight, keep the weight under the normal range. Naturally, 90 to 90% of urinary tract symptoms will come down with the weight reduction, especially stress incontinence will come down very quickly. And suppose they have obese people have some abdomen surgery, cesarean or abdomen surgery, and if they develop hernia in that area, and if they want to pass urine, they put pressure. Most of the pressures will come out through the scum, through the incision. So the pressure may not go there. So these are the symptoms or signs or the problems obese people will face, with the urinary tract. Most of the time they won't recognize these things, but if they have to seek the doctor's help. Thank you.